Welcome to Oxbridge Health, an entirely new approach to healthcare benefits and the home of Episode Advantage. Today, we're taking a closer look at a transformative concept in healthcare, episode benefit plans. While this might sound complex, at its core, it's a revolutionary approach to employee health benefits. And it's an approach we at Oxbridge Health Plans believe could reshape the future of healthcare. We believe that episode benefit plans have the potential to change the healthcare landscape in a way that's similar to how Priceline changed how we compare flight prices, or how streaming services revolutionized entertainment. It's a bold vision, one that addresses some of the most pressing challenges in healthcare today. To understand why this matters, we need to start with the problem we're aiming to solve. Healthcare, as it stands today, is fragmented and often confusing. Costs are unpredictable, and many patients feel they have little control over their own care. The system burdens both individuals and employers alike. Healthcare costs in the U.S. have reached unsustainable levels. Employers are facing significant financial strain in providing healthcare benefits for their employees, while employees are often hit with unexpected medical expenses that create financial hardship. In many cases, patients feel trapped in a system with limited choices and little transparency. At Oxbridge, we recognize this crisis, and we're introducing a solution through our episode benefit plans. These plans aren't about small changes, they represent a complete overhaul of the current model. But rather than reinventing the wheel, we've drawn inspiration from other industries to design a system that combines proven strategies with key innovations tailored specifically to healthcare. We've looked at successful models like narrow networks, reference-based pricing, and episodes of care, and combined them with a few key twists that we believe will improve both the efficiency and effectiveness of the system. Let's explore the core concepts behind our approach, beginning with the 4 magic lanterns. These are the 4 guiding principles we believe will drive the future of healthcare. The first lantern: the future of healthcare is episode-based. This is the foundation of our model. We're not alone in recognizing the importance of episode-based care. Major healthcare consultancies like Mercer, Accenture, and McKinsey predict that episodes of care will play a central role in managing healthcare costs moving forward. But why is this so important? Today, healthcare costs are fragmented. You pay for each doctor visit, each test, each procedure separately. There's little incentive for coordination and no focus on the total cost of care. It's like purchasing every ingredient for a cake individually without knowing the final price or whether the cake will even taste good. With Episode Advantage, we are changing that. We establish a fixed price for the entire treatment process, from diagnosis through to recovery. This incentivizes providers to work together, eliminate unnecessary tests and procedures, and focus on delivering better outcomes at a predictable cost. We're also expanding this model beyond just surgeries or acute conditions. We're applying episode-based care to chronic conditions like diabetes, heart failure, and even mental health care. These conditions often require long-term management, and costs can escalate quickly without proper coordination. By applying episode-based care to conditions and procedures, we estimate that our Episode Advantage program could impact up to 50% of all healthcare spending. That's a significant opportunity to reduce costs while improving care for millions of people. The second lantern: the power of consumers transforms industries. We recognize that consumer choice and price transparency have already disrupted industries like travel and retail. Think about how you book a flight today. You compare prices across airlines, choose the package that best fits your needs, and make an informed decision. We believe healthcare can benefit from this same shift. By giving consumers better access to information and more choices, we can create a more competitive and transparent healthcare market. This will lead to lower costs and a more effective healthcare experience for everyone. Of course, healthcare is more complex than booking a flight. You don't always know what services you'll need until you've seen a doctor. However, by using the episode-based care model, we're making it easier to compare prices for entire episodes of care, not just individual services. Take prescription drugs, for example. In the past, the cost of medications was shrouded in mystery. But once tiered drug plans were introduced, giving consumers more choices based on price, healthcare spending started to slow. We aim to bring that same level of transparency and consumer engagement to the broader healthcare system. The third lantern: consumers want choice. We're all used to having choices in nearly every aspect of our lives, from the products we buy to the services we use. Healthcare should be no different. Studies show that when consumers have more information and control over their healthcare decisions, they tend to choose more cost-effective options. We believe that providing consumers with more choice isn't just a luxury, it's a necessity for a system that works. When consumers can compare prices for entire episodes of care, they're more likely to make informed decisions that lead to better outcomes and lower costs. The final lantern: predictability builds trust. One of the biggest barriers to an effective healthcare system is unpredictability. Studies show that only 27% of Americans trust their health insurers, and much of this distrust stems from the lack of predictability in healthcare costs. By making the system more predictable, we aim to rebuild that trust. When individuals and employers can anticipate healthcare expenses with greater accuracy, it reduces anxiety and fosters positive relationships between patients, providers, and insurers. We're working to eliminate the surprise bills and unexpected costs that so many Americans face today. Our goal is to create a system where everyone, patients, providers, and employers, can have confidence in the prices and outcomes. At Oxbridge Health, we are committed to making healthcare simpler, more transparent, and more affordable. Oxbridge Health. It just makes sense.